Here we have MRI of the pelvis and lumbosacral spine on 25-year-old with history of acute back and pelvic pain with a known sickle cell disease. Because of extensive pain on the right side, the clinical suspicion is osteomyelitis or discitis. So let's explore what we see on these MRIs. So here I'm showing the localizer image. You can see the spleen is extending below the inferior margin of the left kidney. It's this inferior margin of the left kidney, and the spleen is extending much below that, indicative of moderate splenomegaly, which is seen in sickle cell disease. And subsequently, the splenomegaly becomes arthrosplenectomy, and then the spleen size starts reducing. So what we see on sagittal T1 sequence is diffuse low signal intensity of the bone marrow, which is in keeping with known sickle cell disease. On the sagittal T2, we see these patchy areas of low signal intensity in multiple vertebral bodies, especially the ones which are well defined and smaller in the few vertebral bodies, are quite typical for osteonecrosis or bone infarcts. Then moving on to the pelvis, we have got diffuse abnormal bone marrow signal with patchy abnormal bone marrow signal in both femurs, again consistent with red marrow signal change. In the left femoral head, what we see here is a well-defined abnormal signal with surrounding low and central iso-intense signal on T1 away from the articular surface, consistent with a small area of bone infarct. Similar areas are seen in the smaller ones are seen in the right femoral head, and also early or small areas of bone infarcts are shown in both trochanteric region. But what catches our eyes here is this bit here. Compared to the left iliac bone, the right iliac bone shows diffuse increased signal on the fat sat PD sequence, and also there is a mild inflammatory change around the right iliac bone, which is much better appreciated here. As you can see, there is diffuse abnormal signal on the axial stir sequence involving whole of the right iliac bone with mild inflammatory change both superficial and deep to it, but there is no evidence of any muscle edema. There is no evidence of any collection. Um, and here the sacrum also shows extensive patchy abnormal signal on the stir sequence. So what do we make out from this? Is this osteomyelitis or something else? So we give contrast to see what is happening with the enhancement. So this is the post-contrast MRI of the spine and post-contrast MRI of the pelvis, which shows no enhancement of the sacrum or no enhancement of the iliac bone. So based on these appearances, so the chief diagnosis would be acute crisis of the bones, acute sickle cell crisis of the bones, resulting in acute pain. Acute bone crisis happens because of ischemia. As there is no enhancement and there is no evidence of any intraosseous or periosseous collection, no intra or intermuscular edema, features are very likely to represent a sickle cell crisis of the bone rather than osteomyelitis. So, in the report, the chief diagnosis would be sickle cell crisis of the right iliac bone and sacrum, and features are very unlikely to represent osteomyelitis.